My name is Carly Britton, and the community health issue that I will be discussing today is the opioid epidemic. So, I want to start off by talking about opioids and opiates. Opioids are a drug that originates from a plant and can be manufactured to create morphine, opium, and heroin. Opiates are the synthetic version of opioids produced in a laboratory setting. Drugs that are considered opiates are prescription drugs such as Oxycontin and fentanyl. These drugs are used for pain control and treatment. So, the reason why these drugs are so dangerous is when used for pain control, opioids lessen pain by interrupting and blocking the pain sensor from reaching the brain. One of the reasons this process can be so deadly is that the drug binds to opioid receptors on the brain that are linked directly with our brainstem, where the body's autonomic functioning skills are held, such as breathing and heart rate. When we have too many opioids plugging the brain's opioid receptor, the autonomic function suppresses until breathing and heart rate slows to stop. So this is an infographic that demonstrates sort of a relationship between the opioid abuse in the United States in relation to the workforce. So something that I found really interesting is it says that 25% of all workers' compensation costs relate to opioids, and it also states that once a employee does get hooked on opioids or starts using, it is a lot more likely that they will not return to work. Another thing that I found interesting is there's over $504 billion spent on opioid use. Considering the opioid epidemic is a nationwide issue, I want to focus on Pennsylvania in regards to the opioid community health issue. The state of Pennsylvania is ranked number 3 in the highest death rates from opioid overdose in the United States. Opioids, illicit or prescribed, were responsible for 85% of Pennsylvania overdose deaths in 2016, according to the DEA. There were 2,235 opioid-related overdose deaths in Pennsylvania in just 2016 alone. So this is a map of Pennsylvania, and this map demonstrates average deaths due to opioid overdose in every Pennsylvania county. The most concerning part about this map is that there are no counties colored in white, which would mean there were no deaths due to overdose in 2016. And when I was doing my research on Pennsylvania and the overdose rates, as the years went on, the counties got more and more red, which represents more than 40 deaths due to overdose in each county. So this bar graph demonstrates the increasing numbers of deaths from opioids starting in 1999 through 2019 in the United States. From 2010 to 2019, there was an increase that doubled in deaths involving opioids. There was also a large spike in deaths of the male population starting around 2014 that escalated in 2019. So there aren't a lot of pros when discussing opioids, but it is important to understand that they are a very effective treatment for pain, and they are used to relieve pain caused by cancer. But when weighing out the pros and the cons, I feel that the pros really don't outweigh the negative effects that opioids can have on the human body. So some of those cons would be that opioids are the leading cause of unintentional death in the United States. And then in 2019, 70,630 people died from drug overdose, and 10.1 million people misused prescription opioids in the past year. So there also is a lot of increasing numbers in opioid misuse and increasing numbers in related overdoses. And there was also a lot of increasing incidents of newborns experiencing withdrawal syndrome due to opioid use and misuse during their pregnancy. So because this is a nationwide issue, it becomes very difficult to find one solution to end the whole problem as a whole. So you could say that the best solution to end the opioid epidemic would be to get rid of all opioid painkiller medicine used for treatment, which logically speaking, even though opioids cause more harm than good in the community, they do help patients who experience severe amounts of pain reach recovery. That being said, creating more rehabilitation and medication assisted therapies and also raising awareness about the disease of addiction would be the best possible solution, because if you're raising awareness and getting people to understand the actual dangers of opioids and opioid addiction, we can prevent more people getting hooked on the drug itself. Another solution that I came up with is when a patient is prescribed opioids through a medical professional, a start to a possible solution to the opioid epidemic would be immediately enrolling that patient into a rehabilitation program before even starting the opioid. I believe that this will allow professionals to keep an eye on the patient while they take the opioid for their recovery, which will hopefully lessen the chances of addiction. So, what are the HHS and the NIH doing about it? In response to the opioid crisis, the U.S. Department of Health and Human Services, the HHS, is focusing its efforts on 5 major points. These 5 major points are improving access to treatment and recovery services, promoting use of overdose reversing drugs, strengthening our understanding of the epidemic through better public health surveillance, providing support for cutting-edge research on pain and addiction, and advancing better practices for pain management. The National Institution of Health, the NIH, a component of HHS, is the nation's leading medical research agency, helping solve the opioid crisis via discovering new and better ways to prevent opioid misuse, treat opioid use disorders, and manage pain. So some educational material that I found is first this website that is called Taking Action to Address Opioid Misuse. So it's also known as the ATTC, and the ATTC is an organization for users and family and friends of users in order to seek information and help. So with this website, it's kind of like a strictly more of an informational based system, and it teaches family and friends how to cope with their feelings of their loved one who is an addict, and for the addict themselves to learn more about what they are doing by taking this opioid and having this addiction. And the second source is another website, which is called the Center of Constructive Research and Training. So this is an opioid awareness training program. It is an updated training program intended for use by experienced instructors to increase awareness of opioid and disease, the stigma associated with opioid use.